Okay, this is an explanation of the pole work. The pole is any straight line you have. A yardstick will work, a golf club, straight PVC, anything in a straight line that can span the length of your spine from your head to your low back. Okay. What this is to basically teach us, it's an awareness exercise based on stability. We generally use it at the end of our exercise activations. So we do our mobility, our activations, our stabilizers, and then we do this kind of as a polishing move. And what it's designed to do is basically make you aware of how your spine is moving or not moving. When we talk about the 3 points of contact, the occipital protuberance, the back of the head, should contact the pole. I'll take either hand, it doesn't matter, whichever you're more comfortable with. I'm going to put this in the curve where my cervical spine is, where it should be a curve. I'm going to put this one in the low back curve and hold the pole, and I'm going to pull that pole into my spine. Now if I typically have a really bad forward head posture and I always have neck pain, I might find myself like this, and it will feel very odd to bring my head back. That's why you have neck pain. Bring your head back, touch the pole. I touch in the mid-back here, and I also touch in my low back. And this is one of the common cheats people make. I want to touch my low back right where my low back attaches to my sacrum, the triangular bone here in my hip pelvis, okay? So I want to come right to the top of that as close as I can to my low back. People who have a duck butt or flare or an anterior tilt will do this, and they'll think they're okay, but as you can see, I'm not very straight. I need to learn how to tuck my pelvis under, girls who love high heel shoes, and sit back onto my heels. So for people who have that dilemma, they're going to feel as though they're falling backwards, having trouble balance. That's okay, in time you'll sort it out. So touch the head, the mid-back, and the low back right above the triangular attachment here at the sacrum. Stay tall and breathe. Okay, now that I've got that, I'm going to activate a hip hinge. I want to start to bend at my hips. A lot of people suffer low back pain because they only bend in the low back, where they should be bending at the hips. Okay, that's, a nice hip hinge. So I'm going to begin to do a simple forward bend, and I'm going to allow my hamstrings or my knees to bend as my hamstrings tighten up. So keeping those 3 points of contact, I'll bend forward. Don't need much. What you need to do is be aware of when you lose a point of contact. If I start to come forward and my head comes forward, I start over and I try to remedy that motion so that my head stays back and touches the pole. If I bend forward and it comes off my low back here, I'm going to stand back up and I'm going to start again and figure out how I can articulate my hips to maintain that point of contact as I move into a forward bend or a hip hinge. Sometimes I'll cue people by tapping them here, teaching them how to bend at the hips. Okay? So 2 legs is how we function. It allows us to cheat because one leg could be doing more work than the other leg. So the next level of this is a one-legged. So we do 2-legged, and then we start to do a one-legged. So same rules apply. Head, mid-back, low back staying touch. I'm going to balance on one leg, so my feet are together. And I'm going to push my legs straight out, much like the alternating quadruped exercise, and I'm going to bend forward. Come back. Okay, so once again, we'll do 10 or 20 2 legs, we'll do 10 or 20 1 legs. When you start to do the 1 legs, you start to see the rotational instability show up. That looks like when, as people bend, they start to flare out in the hip, they'll start to do this motion. Some people will demonstrate an internal or external collapse of the knee. Those need more specific corrections. We're not going to get into those. You get those in the office yourself. As you do the alternating quadruped exercise on the floor with the rubber band, and you do your chop and lift, you're going to see that that actually corrects. Now, you need to do your activators because there's nothing to connect if you don't do your activation exercises. But that's going to take away this hip flare. Okay? Some people will need a little more detailed exercise on that if they really have a really bad hip flare and we can't correct it with just the basic homework. It's okay, that's why I'm here. But from here, after you do your exercises, so say you just did your pole work and you saw you were flaring really bad, then you went and did your exercises. You might come back and you would probably likely see that you're much more stable in the horizontal and really able to get that leg up using the glute as you come forward, okay? So just do it to awareness. Don't try to do them really fast. High numbers aren't necessary. You just have to do it correct. It's an awareness exercise, okay?